Thank you. Time now to Ask the Expert. Here to answer your questions live on air about popular weight loss drugs and their side effects is Dr. Sonal Haerter. All right, Jamie from Phoenix says, I take several medications for some chronic conditions. Are there any medications that are unsafe to mix with weight loss drugs?
This is a great question.
Yeah.
So one of the things that is important when you go to your doctor's visits is sitting down with your doctor with all your medications. We actually have a tool where we look for interactions, and if they are significant, we modify treatments. For example, weight loss medications like semaglutide tend to interact with thyroid medications, antidepressants, some blood thinners, some asthma medications, some antibiotics. So when you, and certain diabetic medications too.
Right.
So it's important that when you go to doctor's visits, you take all your medications that you're taking and you ask your doctor to check for interactions. Most doctors do. I know I do this in my practice almost every single visit because some of these interactions can be very unsafe.
Yeah, that's a big deal.
Yeah.
Physically bring it in. Why not, right? Yeah,
Yes.
big old Ziploc bag. All right. How long do these typical side effects last?
That's a great question. Most GI side effects that are over 50% patients actually experience GI side effects, nausea, vomiting, diarrhea, fullness, bloating. These tend to last about 2 to 3 months. They gradually get better, and most patients actually report complete resolution by about 3 to 4 months.
Okay, but what if it continues?
If they continue, then we have to modify the dosage or consider another medication.
Oh, wow.
Yes.
All right. Good to know. Next one. I'm worried about not being able to handle the side effects. If I can't, then what?
Okay, so if you are taking these medications for diabetes, there are some other medications that we use for diabetes, as well as obesity. So for obesity, we have 3 to 4 other groups that we use for treatment of obesity. So if people aren't able to tolerate semaglutide or Mounjaro or Zepbound, we do have other options.
Okay, so there's still, I mean,
absolutely,
you know, don't give up completely.
And you know, the other thing, Tram, is depending upon the dose. If you start on a high dose, a lot of patients have significant side effects that are not tolerable. So backing off on the dose, changing the frequency, those are also some other options.
Ways to get around it.
Absolutely.
All right, good to know. Philip says, I just started with Ozempic today to lower my A1C and lose some weight. Once I reach a goal, can I stop using this medication?
Okay, so this is a good question. A lot of people have this question. It actually depends. It's not one answer for all the patients. So for example, if your diabetes is better, if your weight loss is better, and if you stop the medication, some people actually report weight gain following, stopping the medication. So it depends on who the patient is. What I do and what is recommended actually for these medications is lowering the dose. So once you get to the goal, lower the dose, see what your body does. How do you react to that low dose? Keep it at low dose. If you're doing really well, then it is worthwhile to see if you discontinue, does the weight come back? Does their A1C start to go up? Now, what will help here is if you maintain a good lifestyle. That is always going to improve your chances of coming off the medication. But it is all about trial on every patient. It's different for different people.
Yeah, so definitely check in with his own primary care.
Exactly.
Okay. How do you know which drug works best for me? Mounjaro, Wegovy, Zepbound, or Ozempic? Is the criteria different for each?
Oh, this is a good question. So Mounjaro and Ozempic are actually FDA approved for diabetes, not obesity. And Wegovy and Zepbound are FDA approved for obesity. So that's where the distinguishing factor is. Now, we know based on studies that Mounjaro and Zepbound actually help with more weight loss compared to Wegovy and Ozempic. Now, the third factor that plays into this is insurance. What does your insurance cover? So I would say all these medications are great for diabetes or obesity management, but the question is, what does your insurance cover and what is your copay? These medications are pricey. So what is the copay that you are able to actually afford to take these medications?
Yeah, and that could dictate what you end up taking.
Correct.
Yeah. All right, Sonal, that was so valuable information. Thank you so very much.